Question: which of the following conditions is most commonly associated with nephrotic syndrome in adults? A. Membranoproliferative glomerulonephritis. B. Minimal change disease. C. IgA nephropathy. D. Focal segmental glomerulosclerosis. Answer: D. Focal segmental glomerulosclerosis. Explanation: focal segmental glomerulosclerosis, FSGS, is the most common cause of nephrotic syndrome in adults. It is characterized by focal and segmental scarring of glomeruli. While the other options can also lead to nephrotic syndrome, FSGS is the most common cause in adults. Question: which of the following electrolyte abnormalities is associated with Gittleman syndrome? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. Answer: B. Hypokalemia. Explanation: Gittleman syndrome is a genetic disorder characterized by hypokalemia, metabolic alkalosis, hypomagnesemia, and hypocalciuria. It is caused by mutations in the SLC12A3 gene, leading to impaired reabsorption of sodium and chloride in the distal tubules of the kidney. Question: a patient with acute kidney injury presents with muddy brown granular casts in the urine. Which of the following conditions is most likely responsible? A. Nephrotic syndrome. B. Acute interstitial nephritis. C. Acute tubular necrosis. D. Membranous nephropathy. The answer: C. Acute tubular necrosis. Explanation: muddy brown granular casts in the urine are indicative of acute tubular necrosis, ATN. ATN is a common cause of acute kidney injury and is often associated with ischemia or nephrotoxic insults, leading to damage to the renal tubular epithelial cells. Question: which of the following medications is known to cause drug-induced interstitial nephritis? A. Furosemide. B. Lisinopril. C. Acetaminophen. D. Vancomycin. Answer: D. Vancomycin. Explanation: vancomycin is a commonly cited medication associated with drug-induced interstitial nephritis, which can present with acute kidney injury, fever, eosinophilia, and white blood cell casts in the urine. Question: a patient with end-stage renal disease, ESRD, on hemodialysis presents with severe joint pain and calcium pyrophosphate crystals in the joint aspirate. What is the most likely diagnosis? A. Gout. B. Pseudogout. C. Rheumatoid arthritis. D. Osteoarthritis. Answer: B. Pseudogout. Explanation: pseudogout, also known as calcium pyrophosphate deposition disease, CPPD, can occur in patients with ESRD due to abnormalities in calcium and phosphate metabolism. It presents with joint pain and the presence of calcium pyrophosphate crystals in joint fluid. Question: which of the following is a common extrarenal manifestation of systemic lupus erythematosus, SLE, that can also affect the kidneys? A. Pleuritis. B. Malar rash. C. Scleroderma. D. Psoriasis. Answer: A. Pleuritis. Explanation: pleuritis is a common extrarenal manifestation of SLE and can also affect the kidneys, leading to lupus nephritis. Kidney involvement is a significant cause of morbidity and mortality in SLE. Question: a patient with polycystic kidney disease, PKD, presents with severe flank pain and hematuria. Imaging reveals multiple cysts in the kidneys. What is the most likely diagnosis? A. Autosomal dominant PKD. B. Autosomal recessive PKD. C. Medullary sponge kidney. D. Simple renal cysts. Answer: A. Autosomal dominant PKD. Explanation: autosomal dominant PKD is characterized by the development of multiple renal cysts, leading to enlarged kidneys and various renal complications, including hematuria and flank pain. Question: which type of renal tubular acidosis, RTA, is associated with impaired hydrogen ion secretion in the distal tubules and may present with hypokalemia and nephrolithiasis? A. Type 1 RTA. B. Type 2 RTA. C. Type 3 RTA. D. Type 4 RTA. Answer: A. Type 1 RTA. Explanation: type 1 RTA, also known as distal RTA, is characterized by impaired hydrogen ion secretion in the distal tubules, leading to metabolic acidosis. It may present with hypokalemia and nephrolithiasis due to decreased urinary citrate excretion. Question: which of the following conditions is associated with the formation of staghorn calculi in the kidneys? A. Nephrolithiasis. B. Renal cell carcinoma. C. Tuberculosis. D. Polycystic kidney disease. Answer: C. Tuberculosis. Explanation: staghorn calculi are large, branching kidney stones that fill the renal pelvis and calyxes. They are commonly associated with renal tuberculosis, which can cause chronic granulomatous inflammation and stone formation. Question: a patient with chronic kidney disease, CKD, presents with anemia. What is the primary mechanism of anemia in CKD? A. Increased erythropoietin production. B. Decreased red blood cell lifespan. C. Iron overload. D. Increased bone marrow activity. Answer: B. Decreased red blood cell lifespan. Explanation: anemia in CKD is primarily due to a decreased lifespan of red blood cells, which is a consequence of reduced erythropoietin production and impaired iron metabolism. This condition is known as anemia of chronic disease.